Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse in a degree medical surgical nursing. I create nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. You hit the notification bell so that you will be the very first to watch my newest uploads every time I upload them. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone. Yes, today is another Wednesday, another day for us to review and have a lecture regarding your nursing school and your nursing study or your nursing profession. And like you see on the title, this is all about your white blood cells and differential. Another entry natin sa playlist natin, sa cheat sheet playlist, where I create short and quick nursing notes that you can use to help you refresh and memorize some of the concepts in nursing. And if you haven't watched the other videos I created under this playlist in this line of topic, I actually have like lecture regarding the cardiac markers, coagulation profile. Yeah, some of the laboratory values that we have. I'll be putting the actual playlist link on the description box or whenever the icon button pops out. Check it out because that's all for you for free. Use them. Okay? Now, gusto ko lang magpasalamat sa lahat sa inyo na patuloy na sumusuporta sa channel ko. Maraming salamat po. And kung bago ka dito sa channel ko, hello sa'yo. Welcome. Welcome sa ating online classroom discussion. Ating online class. Thank you so much. And do me a favor. Just make my day today. Give this video a thumbs up and share it with your friends. Tag me on your social media account. I have basically everything. Facebook page, Instagram, all in this the description box. Bakit ba ako parang nabubulol? So, mabilis lang tong discussion na to and gusto lang kitang anyayahan kung hindi ka pa nagsusubscribe sa Facebook page ko because this video presentation, this class is also going to be available on my Facebook page. It's Neil Galve Official. I would also like to invite you to please watch the previous lecture that I uploaded on Monday. That was all about the spinal cord. Continuation of your nervous system lecture materials that I'm currently series of lecture materials that I'm currently doing for you guys. Now, meron din akong podcast ha. Meron akong 3 a.m. conversation with Neil Galve. I uploaded an episode yesterday after a while. Can you imagine? That was really, really fun and I hope you guys can hear it. Ayan. So, eto na. Hindi na tayo magpapatumpik-tumpik pa. Today is all about your white blood cells, WBC, WBC, and differential. So let me share to you the objectives for today's discussion. So we're going to discuss what is WBC, definition of terms. We're also going to have the components of your WBC, normal and critical lab values for white blood cell count, normal lab values for WBC differential, and what are the indications of increased WBC, tinatawag nating leukocytosis, and decreased WBC count, o yung tinatawag nating leukocytosis. And this is not going to be a nursing study guide if we're not going to include your nursing consideration for WBC count. Saya, diba? Exciting. Short and quick and very, very juicy topic. Eto na tayo. Let's begin. So, what is a WBC? Pretty short, quick, and straightforward. So let me give you the definition. So, white blood cell act as the body's first line of defense against foreign bodies, tissues, and other substances. WBC count assesses the total number of WBC in cubic millimeter of blood. So, WBC, first line of defense against infection. All right? Sila yon, infection, foreign bodies, tissues, anything that is unfamiliar to the body. Sila yung first line. Sila yung para mga pulis pang kalusugan, pang kalawakan ng ating katawan. So white blood cell differential provides specific information on white blood cell types. So, malinaw ba yun? Malinaw. Now, let me give to you the components of your WBC. Huwag malilito ha. Yung WBC, acronym siya ng white blood cell count. Eto na tayo. So, we are going, based on the picture that you're seeing right now, I'm going to discuss to you the components. Ano-ano ba yung mga components ng WBC mo? Eto na. We have your neutrophils. Narinig mo na to for sure. Neutrophils are the most common type of WBC and serve as the primary defense against infection. Primary defense, neutrophils. Lymphocytes play a big role in response to inflammation or infection. You are talking about inflammation, pamamaga, swelling, or infection. You're talking about lymphocytes. How about your monocytes? Narinig mo na rin to. Monocytes are cells that respond to infection, inflammation, and foreign bodies by killing and digesting the foreign organism, or what we call the phagocytosis. When you heard about phagocytosis, you are talking about your monocytes. It's also responsible for any type of infection, inflammation, and foreign bodies. But the only difference is the way it works. It is kills the foreign bodies by digesting it. Phagocytosis, through the process of what we call phagocytosis. We also have your eosinophils. Eosinophils respond during an allergic reaction and parasitic infection. You're talking about bulate sa tiyan. You're talking about allergic reaction, anaphylactic shock. You're talking about your eosinophils. Basophils are involved during an allergic reaction, inflammation, and autoimmune diseases. You're talking about lupus. You are talking about your basophils. How about bands? Bands are immature WBCs that are first released from the bone marrow into the blood. Once again, these are the components or the types of your WBCs. Neutrophils, lymphocytes, monocytes, eosinophils, basophils, and bands. Alright? So, eto na tayo. Let's discuss normal and critical lab values for white blood cell count. What do I mean by this? Eto na po siya. Let me give you a table. Ayan. So, ito yung mga normal lab values in terms of age group. And I give you two units here. The SI units, Standard International Units, and the conventional range or the conventional units. Alright? So, in terms sa adult, ang normal range niya sa SI units natin is 5.0 to 10 times 9 to the power of 9 cells per liter. When you talk about your conventional range, 5,000 to 10,000 cubic millimeter. Sa children, less than 2 years old, you have your 6.2 to 17 times 10 to the power of 9 cells per liter. Conventional range, you have your 6,200 to 17,000 cubic millimeter per cubic millimeter. Sa newborn, mga bagong silang, you have your SI units, that's 9.0 to 30. That's the normal range times 9 to the power of 10 to the power of 9 cells per liter. So conventional range, you have your 9,000 to 30,000 per cubic millimeter. How about the critical values, you guys? So sa SI units, if your facility is using SI units, this is how you're gonna see it in the CBC result or serum result, blood result. You have your 2-point critical values for SI units is 2.0 to 40 times 10 to the power of 9 cells per liter. Conventional range, pwede mo siyang makita ng ganito, less than 2,000 or greater than 4,000. Less than 2,000 or greater than 40,000 per millimeter. Hindi ako marunong mag-numbers, dai. 40,000 millimeter. Okay? So, once again, this is the normal lab values of your what's this? WBC. Now, kung bago tayo mag-proceed ha, kung hindi ka pa nagsasubscribe, mag-subscribe ka na sa channel ko, nakakaya naman sa'yo. Alright, so we're gonna have your normal lab values for WBC differential. Ito po siya, wag malilito. Okay, so we're gonna discuss by each, inaalala mo yung classification and types of WBC that we discussed earlier? Kada isa sa kanila, yung monocyte, eosinophils, basophils, bands, kada isa sa kanila may normal values. Okay? So, kapag, let's say, tumaas, for example, itong eosinophils mo, which is responsible for parasites or allergic reaction, meaning your patient is probably suffering from parasitic infection or allergic, or is having an allergic response, right? Right. So, let me share to you the eosinophils. That's how you're going to correlate the result of your blood works with the presenting manifestation of your patient and trying to ruling out your the disorder of your patient or whatever the patient is suffering from. So these are the differential of your WBC. You have your neutrophils. Let me change my cursor here. You have your neutrophils, lymphocytes, monocytes, eosinophils, basophils, and bands. Dito, say meron tayong range SI unit, standard international unit, and we have here on this last row your range or column range and conventional range. All right, so isa-isahin natin to. Neutrophils, ang normal range mo is, first of all, sa conventional is 55 to 70%. If you're gonna translate that in SI unit, that is 2,500 to 8,000 per cubic millimeter. Okay? 55 to 70%. Nakita ko to sa facility namin, nagbasa ako ng isa sa mga blood works, naka-conventional range kami. 55%. Alright? So, lymphocytes, we have 1,000 to 4,000 per cubic millimeter range. Ang range nun sa SI unit. Sa range naman niya, when you talk about conventional, that's 20% to 40%. Monocytes, that is within 100 to 700 per cubic millimeter sa SI unit. When you talk about your conventional, that is 2 to 8%. Eosinophils, that is 50 to 500 per cubic millimeter. Sa range, 1 to 4%. That is for your eosinophils. Alright? Hindi, ibig sabihin, pag mas mataas yung eosinophil level ng pasyente mo within sa normal range, let's say 50%, paano yan? Expect mo na may parasitic infection or probably merong anaphylactic reaction ang pasyente mo, right? Right. Hold on a second. Alright, so let's proceed. Basophils, ano ang normal range niya sa SI? SI unit, 25 to 100 per cubic millimeter. So conventional range naman, 0.5 to 1%. Diba, ang baba? Bands, which is the premature WBC, which is the first one that is being released from your bone marrow, that is 0 to 700 per cubic millimeter, and sa conventional range, that is 0 to 2%. Alright, so naintindihan ba yon? Nagets nyo ba yon? Absolutely. Balik-balikan mo lang to because this video is going to be divided into chapters. If you're watching it on YouTube, there's actually an option for me to create a chapters per video. So it's going to be a lot easier for you to memorize and understand. Okay, so let's proceed. What are the indication of increased WBC, or what we call the leukocytosis? And decreased WBC are also known as leukocytosis. Here I am going to give you some of the disorders that your patient is probably having if he or she is, let's say, diagnosed with leukocytosis. Ano-ano kaya yung mga disorder na yon? Okay, mag-alala because I'm going to give you a example of that on the next slide. Eto na tayo. So, increased WBC count of what we call leukocytosis may indicate the following. Makinig na mabuti. You have your inflammation, swelling, infection. Your patient is probably having leukemic neoplasia. Stress. Yes. O, diba? Sa mga stress dyan. Paano na to? And also tissue necrosis. We also have your trauma. Once again, these are the indications of your increased WBC. Mga disorder na maaaring i-rule out ng doktor whenever the patient is having any type of increase in WBC. Sa infection pa lang, napakaraming klase ng infection na i-rule out together with the other confirmatory procedures to confirm the certain condition and certain disorder that your patient is having. So, mapapansin mo, lagi may blood works kasi sa mga standard, mga bundles, right? Sa pag-rule out ng doktor. Next, decrease WBC count. Paano naman kung mababa ang WBC mo, yung tinatawag nating leukopenia? What are the possible reasons why mababa ang WBC? Ito na siya, autoimmune diseases. Ano yung mga kasi ng autoimmune? AIDS. What else? Lupus. We have here your Addison's disease, your celiac disease, dermatomyositis, your Graves' disease, myasthenia gravis, GBS. Those kind of things. Those are the examples of your autoimmune diseases. Okay? We also have your bone marrow failure. Kaya mababa ang leukopenia. Mababa ang WBC kasi nga may bone marrow failure. Ibig sabihin, saan ba pinoproduce ang blood? Hindi ba sa bone marrow? Kapag may sira, may defect ang bone marrow mo, do you think that the blood will not gonna be affected? Of course, it's going to be affected in terms of the numbers and the production of your blood, not just your white blood cells, but also your RBC. All right. So, bone marrow infiltration, example, myelofibrosis, congenital marrowaplasia. We also have your drug toxicity. Example nito, yung chloramphenicol. And nutritional deficiency sa may mga malnutrition and severe infection. Once again, these are the indications for your increased WBC and decreased WBC count. Alright? Now, malapit na tayo matapos sa ating discussion. Kung hindi ka pa nagsasubscribe, baka naman, mag-subscribe ka na for today's video. Char! Eto na, nursing consideration for WBC counts. Ano-ano ba yung mga dapat mong isaalang-alang? Wow, ang lalim. What are the things that you need to consider every time you are going to look at your patient's serum or CBC report and you see that your WBC is up, elevated, or decreased? Eto siya. Don't worry because I got you, girl. Una, a high total WBC count with the left shift means that the bone marrow will release an increased amount of neutrophils in response to inflammation or infection. That's one. Next, a shift to the right, which is usually seen in liver disease, megaloblastic and pernicious anemia, and Down syndrome indicates that cells have more than the usual number of nuclear segments. A shift to the left indicates an increased number of immature neutrophils is found in the blood, yung band na tinatawag. We also have, lastly, a low total of WBC count with the left shift means a recovery from bone marrow depression or an infection of such intensity that demand for neutrophils in the tissue in greater than the capacity of the bone marrow to release them into the circulation. Diba? Diyan na nga natatapos ang ating discussion for today's video. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. You let me know if you have other nursing topics that you want us to do. You comment it down below. Abangan mo nga yung upload natin this coming Friday because it's going to be a lot of fun. And tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sirang pinakabago, pinaka-fresh, at ang pinaka-libreng nursing review centers sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. Follow me. On my Facebook page, it's Neil Galve. And I have a podcast channel. It's 3 a.m. Conversation with Neil Galve. Ano daw? Wait, nabulunan na ako. And tomorrow I'm going to upload another episode on my podcast. I'll see you guys there. All right, you have a good one.